Hi, my name is Lucas K. Puckett, and I'm doing a presentation about the high maternal mortality rate in Indiana and trying to reduce that rate through education and an awareness campaign. Indiana has one of the highest maternal mortality rates in the United States of America. It's within the top 10 states. On average, from 2018 to 2022, Indiana had a rate of 30.9 maternal deaths per 100,000 live births. In comparison, the United States had only 18.6 deaths, nearly half of what Indiana had. To define a pregnancy-related death in relation to maternal mortality, it's a death that occurs during pregnancy or within 1 year of the end of pregnancy from a pregnancy complication, a chain of events initiated by pregnancy, or from an unrelated condition related to the effects of pregnancy. Contributing factors for the much higher than average maternal mortality rate in Indiana include substance use disorders, mostly accidental, mental health conditions, and obesity. Of the deaths that were reported, a coalition in Indiana found that nearly 70% of those deaths were preventable with some sort of reasonable change to patient, family, provider, facility, or community factors. To compound that issue, many women in rural Indiana lack access to OB/GYN services at all or completely. They either lack providers within the county or lack a birthing hospital within their county. Almost 40% of counties in Indiana lack access to a birthing center. The project that I've designed is an education campaign. People cannot address an issue if they don't know that this issue exists. To begin addressing the issue, a public health education campaign needs to be made. The CDC has resources already available to disseminate to the public about signs and symptoms that women should look out for through their Hear Her campaign. There are signs and symptoms such as severe headache, dizziness, fainting, suicidal thoughts, vision changes, fever, severe abdominal pain, cessation of fetal movement, those types of things. But my education campaign will also include risk factors such as substance use disorders and mental health issues. The first step would be to start out locally, advertising on billboards and social media to bring awareness to Indiana's high maternal mortality rate. We could provide pamphlets and brochures to ERs, OB/GYN offices, labor and delivery departments, so that those staff could further educate the patients on the risk factors to look out for and when to seek further medical attention. And then that patient would have physical information they could take home to reference in the future if they do experience any of those issues. Empowering the women of Indiana is the first step here, and giving them the necessary information is going to help the alarming rate of Indiana's maternal mortality rates. The objective of this project is to lower the overall rate of maternal mortality in Indiana. Even 1 percentage point could be one life saved, and one life saved would be a success. However, that's not enough. 0 preventable deaths due to pregnancy-related issues in Indiana would be the ultimate goal. Some of the major stakeholders that could help with the education of Indiana's women about the high mortality rate would be the Indiana Department of Health. Not only does the Department of Health have access to the information, but also to access to providers, locations, addresses that we could focus on to send our educational materials to. Other local stakeholders could include women's rights and advocacy groups. It could also include nursing organizations such as the ENA or Emergency Nurses Association, also the Association of Women's Health, Obstetric, and Neonatal Nurses. You could also look for women-owned businesses, and also reach out to your local health department for resources. The plan to implement this education campaign would start with design of the education materials. You could make informational pamphlets, posters, cards, and those could all have QR codes that people could scan for further details that would take them to the website that you could make that would have access to links, resources, and further information to bring awareness to Indiana's high maternal mortality rate. Specifically, the website could go much more in depth about signs and symptoms to look out for during and after pregnancy, such as preeclampsia, gestational diabetes, causes of vaginal hemorrhage, and when to seek medical attention for excessive bleeding. It would also further help educate women on infection and sepsis, the signs and symptoms for that, also the risks for hypertension and cardiovascular issues. The pamphlets and handouts would reference the website so that people could go there to find resources for their psychological issues, their mental health and addiction issues. It could reference local resources like the Hamilton Center in Terre Haute, or national resources such as the Maternal Mental Health Hotline or the National Center for Substance Abuse and Child Welfare website. Now that the design and forms of education are formatted, we need to move on to finding our funding. We would look at our various stakeholders to try and enable that. The local health department may have funding available to help with health education campaigns, though it would likely be a modest budget and they would be able to contribute very little. Most funding would likely have to come through fundraising campaigns, speaking to various groups involved in women's health, like the nursing association groups. You could also look into grants online, either local or federal grants, state or federal. I know Indiana has Indiana Health Issues and Challenges grant through the Health Resources and Services Administration, and also grants from the Centers in Excellence, Maternal and Child Health Education, Science and Practice grants, and Maternal and Child Health Public Health Catalyst Program grants. However, grants may be a more difficult and time-consuming option. It takes longer to write out the application for the grant, and also longer to go through the process, various steps of the grant, and find out the eventual winners of the grant, which could likely take up to 1 to 2 years to obtain grant funding, whereas local funding could be obtained as easily as the night of or within a month of speaking to various groups. Now that we've obtained our funding and we've designed our education materials, we can move on to disseminating our information to the local health department and local physicians' offices, ERs, labor and delivery offices. Mostly locally, this would be an office-to-office campaign where they would have better buy-in from us reaching out to them personally, showing them the education and our passion in reducing the amount of maternal mortalities in Indiana. Once we've proven success locally with buy-in from local providers and organizations, then we could take that information and those successes to the state health department and try to convince them to support our educational campaign above other campaigns they may have in the lineup. Once we've put out the health information campaign, it's to the public, they're seeing it, they're going through it, we need to measure our progress. Measuring progress will likely take at least a year or two after we put out the education campaign to be able to really measure the success. It will take time for all the county health departments to compile numbers, for that to go to the Indiana Department of Health, and then for the maternal mortality committee to review and go over those maternal mortality deaths. to see whether or not our education campaign really did make an impact on women's mortality rates. The resources we would use locally would include local printing businesses to help design and print out the brochures, approximately about 2,500 locally for Vigo County. We could hand deliver those without much overhead. Social media advertising to bring awareness to the issue would all be technologically based and online. The resource there would just be money, and also website design would also be online without much locally resourced issues. Challenges and factors that I foresee with this education campaign would be of trying to implement with projects that are already in place or planned to be in place with the Indiana Department of Health. I think locally it wouldn't be an issue, but having it to be a statewide project would take time and convincing to state authorities. However, I don't think it would be a left-wing or right-wing issue, and I think it would be supported by both sides of the aisle politically. Economically, with a booming economy, people and corporations have plenty of money to spend and give to charity and causes. However, today, economically, there's slowing growth, a cooling labor market, and inflation is still up. It's trending downward. So you may find it more difficult in obtaining funding from corporations and associations, and there may be less grant opportunities out there for funding considerations. Social factors, I don't foresee any challenges other than making sure that you're presenting the education in a manner that the majority of the population can understand. The average reading level in the United States is at a 7th to 8th grade level, and that's average is 50%, right? So I would probably try to present the education campaign at a 6th grade level or above. Most women of childbearing age are from the technological era, so I don't foresee any problems with them accessing information via technology, via QR code or website, using resources online or links. Legally, I don't think there are any legal restraints. Should have no issue providing education and resources to a targeted audience. You just want to make sure that your information and education is sound and has evidence-based practice and peer-reviewed articles to back up the information you're giving out. The timeline to get this education off the ground: designing and printing the pamphlets, maybe 2 to 3 months. Website, same time frame. Finding funding is going to be your most time-consuming process. I would say that would take 6 months to a year to secure all the funding. Once you can do those things concurrently as well, so it's not adding time on top of time. Those things can all happen at the same time. So I would say perhaps within 1 year you could implement the education, and then you have to let the education run for at least a year to provide any meaningful impact on women's health. After the education has been out for at least a year, then it would take probably at least another year or two to look into all the data and extrapolate how well your education has reduced the maternal mortality rate in Indiana. Budget-wise, I saw estimates up to $20,000 to print out brochures for an entire state, around 200,000 pamphlets, up to $10,000 for website design and maintenance, $12,000 for social media campaign advertisements, and then throw 20% on top of that for unforeseen expenses, for a total approximate from $55,000 to $60,000. In summary, Indiana has work to do on maternal mortality. Education is the first step, and that takes time and resources. To deem this project successful or not depends on the number of preventable mortality deaths in the future. Once the project has been in process for a year at least, we'll have to look through the data to see if there's been any impact made. Once we have that data, we can then look for better routes to access more people and provide better education to the people that need it. Thank you.